In this presentation, we will be covering about home-based palliative care services. The example has been taken from Gujarat Cancer and Research Institute, Ahmedabad, and the presentation has been prepared by Dr. Geeta Joshi, Director, IIDL, and President, National Association of Palliative Care for Ayush and Integrative Medicine, Ahmedabad. Where can palliative care be given? We have already learned that we can give palliative care in OPDs, hospital based palliative care, in IPDs too, and in hospices. Day palliative care units are also there, and community supported home based palliative care services are also being rendered. In the models of care, let us remember that no one is right or wrong when the model for the provision of palliative care services come into picture. The best model is determined by the local needs as well as present resources. We can see Dr. Geeta Joshi talking to a patient during home care visit. Home-based palliative care is a care provided to people with chronic, debilitating and progressive disease, which are potentially life-limiting such as cancer, and stage cardiac, renal and respiratory diseases, HIV/AIDS and chronic neurological and psychiatric disorders in home or live-in environment of the patient. We have to remember some of the principles in home-based palliative care. We have to affirm life and regard dying as a normal process, to neither hasten nor postpone death, to provide relief from pain and other distressing symptoms should be our goal, to integrate the psychological and spiritual aspect of the patient care, to offer a support system to help patients live as actively as possible until death, that too at home, as no one prefers to die in the hospital and that too within an ICU, to offer support system to help the family cope during the patient's long illness in their own bereavement. What are the features of home-based palliative care? It is suited to the convenience of both the parties and tailored to meet the needs of patients as well as their families. Empowerment of the patient and the family is the foremost concern in case of home care services, and this is delivered by a trained team. Advantages of home-based palliative care are easy access to care, most effective caring, access to complementary services, expert referrals for the patients, maintains confidentiality. It spreads awareness within the community too. It mobilizes the local resources, prepares the patient and family for end of life care, offers bereavement support as well as training opportunities not only to the family, but the caregivers and neighbors. Basic components of home-based palliative care involve, first of all, a willing and accessible patient, an available caregiver which may be a family member or a neighbor, a conducive stigma-free home situation, a trained team, 24-hour support, transportation whenever required, network of supportive care as well as a carefully prepared home care kit. How it started at GCRI? Initially, it was started for VIP and known patients. It was started for dressing, insertion of Ryle's tube, catheterization. Philanthropic donor to Gujarat Cancer Society were there. Initially, it was done by RMO, staff nurse and resident doctor, and Department of Pain and Palliative Care took over it since 2010 for providing home care. The Hospice Day celebrations have been done on 9th October 2010, and we can see it was Navratri, titled Sharing the Care. It was in pain and palliative care OPD services, and we can see the patients participating in this and enjoying the event. So, those patients who recover, naturally they want to work for other patients too and motivate them for recovery. So, this is a vehicle dedicated for providing home care services by Lodge Fellowship to GCRI in January 2014. And this vehicle goes along with the team to visit home care patients, whom they attend, the homebound patients, elderly caretakers, because many a times those who are elderly are bedridden and need palliative care services within their home. The financial barriers may be there to bring them to the hospital many a times. Whoever requests, they are given this facility, and few non-cancer patients also get home-based palliative care. Procedures which are performed at home, they may be insertion of Ryle's tube, fixing of urinary catheter, it may be management of bedsore dressing, it may be wound care, giving injections, and sphenopalatine ganglion block to reduce the pain. Here we can see the advanced cancer patients' wounds, and remember they are not very easy to manage, as they have very foul smell, and these are not going to heal. So, here are the statistics regarding number of patients visited during the various years. What does the staff say about it? It is very difficult to find the location of the patient. Some people do not want our home care van to be seen by neighbor because of social stigma. We all know that most of the time people are not told about the disease, and even if the family knows, they do not want the disease to be shared with the neighbors. Few relatives want to care for patient, hence they do not need our services. Few expect more than what are provided in home care, that is emergency services, but emergency services cannot be provided during home care visits. We have to understand it. We can see here one of the counselor talking to the patient during home care visit. Here are the glimpses of the team interacting with the patients, and we can see the smile in the face of the patient. That is what the rapport is. Dr. Geeta Joshi talking to the patients during home care visit, and she is interacting with the patients, and we can see the satisfaction in place of agony on the faces of patients during home care. What is the road ahead? Liaising with local doctors and home care vehicles, training center for home care, paramedical volunteers as well as carers, extension of services to non-cancer patients, extension of services to PHCs and CHCs, which is very important presently. And we can see a glimpse of the home care center from where this home care team is managed at GCRI. Here we can see the members of the home care team along with Dr. Geeta Joshi in the center. Thank you.